Hello, hello, hello. You are listening to the Aligned Birth Podcast. I am one of the hosts today. So you only have one host, Dr. Shannon, prenatal chiropractor. And that means that it is an interview day. And so today I've been dying to have this guest on, I think since we started the show. And so I'm really excited to have her on today because we're talking about all things breastfeeding and lactation support. So we have Jana Birdseye on today. And so she is an IBCLC and RLC. And we're going to talk about what all of those acronyms mean. But the big thing we're talking about is breastfeeding support, lactation consultants, and what they can help with and how they can help. So we're going through what those acronyms mean, how they support mother baby. It's more than just a good latch. And we want to go into what are the things to look for when you are working with your infant and you have your newborn and you're trying to establish this nursing connection, which can be difficult. It can be challenging. And so having that support team is so important. So we're going to touch on all of those things today. So Jana, she's a local to Metro Atlanta lactation consultant, IBCLC. She's licensed IBCLC RLC. She's the Chief Operating Officer and Director of Corporate Lactation at Lactation Consultants of Atlanta. So that is her business name. And the Sitting Vice President of SELCA. We're also going to go over what that means as well. She graduated with honors from Georgia Northwestern Technical College Lactation Program in December of 2019. She has 2 daughters and 1 grandbaby and is happily married to her husband, Drew. And I am so excited to have this guest on the show today. Welcome to the Aligned Birth Podcast. I'm Dr. Shannon, a prenatal chiropractor.
And I'm Rachel, a birth doula and childbirth educator. Together, we're here to bring you conversations about pregnancy, birth, and motherhood. From cesarean to VBAC, hospital to home births, we've experienced it all. We are high school friends who reconnected through our shared passion for health and birth. As moms to 2 young boys, we've both changed careers after our own transformative childbirth experiences.
Join us as we discuss the importance of a healthy body and mind throughout pregnancy, birth, and into motherhood. Our goal is to provide fun, interesting, and helpful conversations and interviews that inspire learning. When your body, mind, and intuition are aligned, you can conquer anything.
Sit back and relax, or grab a notebook and take some notes, or maybe listen as you enjoy a walk. However you choose to listen, we hope you enjoy this episode of the Aligned Birth Podcast. Before we get into the episode today, if you enjoy the content of this podcast, we would greatly appreciate your support in one of 3 ways. First, leave us a review or give us a 5-star rating. Your feedback helps us reach more listeners and make a bigger impact. Second, you can sign up for our newsletter. By doing so, you'll be the first to receive new episodes and exclusive bonus resources straight to your inbox each week. Lastly, you can become a direct listener supporter. Running this podcast requires significant time, effort, and resources. Your contribution, no matter the amount, helps us continue providing valuable content to a wider audience. Simply use the links in the show notes to make your donation, sign up for our newsletter, or leave us a review. Every contribution matters and is sincerely appreciated. If the Aligned Birth Podcast is a part of your weekly routine and you love what we are doing, please consider supporting us through one of these 3 options. Your support will create a ripple effect, allowing us to reach more listeners and make a lasting difference.
So welcome, Jana.
Hey, Dr. Shannon. I'm super excited to be here too. I've been following your birth podcast ever since you got it started, so I try to tune in sometimes. So thank you for having me out today.
Yes, of course, of course. And we've had some birthy topics, we've had a lot of birthy topics. We've had some breastfeeding topics on the show as well. So I have links, I'll put those in the show notes too, because I just want this to add to that knowledge because Rachel and I have talked about it, but neither one of us are IBCLCs. We're just moms who did breastfeed and had successful breastfeeding journeys. So we have some knowledge there, but that's why I'm like, no, we need the real knowledge base here. So I want to start with what does IBCLC mean? And I know that it's a very rigorous process. And so I want you to go into what that certification looks like and what that means so people can kind of understand that a little bit better.
Okay. IBCLC is International Board Certified Lactation Consultant. And basically what that means is that with our certification, we can practice anywhere in the world. So it's not just specific to the United States. It is international. I mean, it's all across the board. So that's pretty exciting if I ever wanted to, move across the world or anything.
Travel abroad. I know. That's so cool. I didn't know that.
Yeah. And so a lot of times with the certification, we actually have to learn lactation specific rules and practices across the world. And then also to practice here in the United States, we have to learn certain healthcare practices that only apply to the United States. So, but for our board certification, we kind of go with a worldly view for that type of thing. Education, you can get it in 3 different ways, which is also a little bit confusing, but there's 3 different pathways. Each pathway, you have to have 95 specific lactation education hours, and then you also have to have clinical practice hours. And so I did pathway 2, which was through Georgia Northwestern Technical College in North Georgia. And I did 14 health science courses, and that's expected through all of the pathways. And each pathway just means that you do different levels of clinicals. So pathway 2 is 300 hours, and you kind of, with the college, we actually had different clinical sites. So such as hospital-based, private practice-based, pediatrician, IBCLC. So we can be in any type of setting to help mothers get breastfeeding off to a good start or even overcome problems. And then
that's
the
cool.
other
Now, I was going to say, personally, I know in the hospital, I remember having a lactation consultant, but then at the pediatrician, I remember I had a really good relationship with the lactation consultant there. And I thought that was so helpful having that at the pediatrician office. So that makes sense that that's a place that you can do those clinical rounds.
Mm-hmm. I wish there was a lactation consultant in all pediatricians' offices and all hospitals and all OB offices.
I do too.
Yeah, I think that would be very beneficial to mothers and breastfeeding parents and just babies everywhere and the breastfeeding rates across the United States.
I know.
What was
Most
that?
definitely. And that was one of the things I wanted to mention too, was the aspect of, I like that you mentioned that, because I think every mother baby dyad should see a lactation consultant, whether they think that there are, I'm using quotes, issues or not, because breastfeeding issues can manifest in a bunch of different ways. It doesn't have to just be, oh, the latch is painful or the non-efficient feeding. Like there's so many other little things. And I know we'll get into that. Okay. So that was IBCLC, correct?
IBCLC, yes. International Board Certified Lactation Consultant.
There we go. Now, not all lactation consultants are IBCLC, right?
No, there are some CLCs, which is a Certified Lactation Counselor. There's CLE, Certified Lactation Educator. So there's different levels of lactation education, and really it's just the education that kind of sets us apart. We carry the gold standard for the health science courses that we have to do, 95 hours, all the clinical hours, and CLC is like a 2-week course, I believe. CLE is kind of similar to that. So those are more of like a counseling, and they are beneficial for some dyads, but some who have more clinical needs should definitely see an IBCLC.
That's what I wanted to hit home, was that the difference there in, I feel like it is a very rigorous program and you have so many clinical hours, but it's needed, like there's a lot to learn in there if you really want to dive deep into that breastfeeding journey.
there is a lot to learn. And then even the continuing education hours that we have to do after, we have to recertify every 5 years. So we have to stay on top of things. And then there's different specialties that you can kind of pick up and specialize in different areas. Like I would say one of my specialties is babies who have been diagnosed with tongue tie and lip tie, and babies with special needs. We'll get into that in a little bit too.
I was going to say, so what brought you into the lactation world? Like, how did you decide on this as your career journey?
Well, through circumstances, I had been in retail marketing, management, business management for over 20 years. And then I met my husband, and we had a daughter named Anna. She's now 8. Anna was born with Down syndrome. It was a surprise. My husband's mother is a lactation consultant. She actually is the founder of Lactation Consultants of Atlanta. And prior to Anna's birth, I didn't know if I wanted to breastfeed or not. I was never pressured by my mother-in-law. But as soon as Anna was born, I just kind of looked down and I'm like, does she have Down syndrome? And I mean, it was very traumatic at the time. We're okay now. She's amazing. But when I finally got to hold her, I realized I wanted to breastfeed. We had a lot of issues, not related to Down syndrome at all, but related to tongue tie and lip tie. And I went through about 6 lactation consultants before someone actually took the time with me to really figure out what our issues were. And after that, I breastfed her. I mean, she was partially breastfed, partially formula fed for 22 months. And then throughout the years, my mother-in-law had kind of talked about retiring or semi-retiring on and off. And I always thought, well, if I was an RN, I would become an IBCLC and take over her business. If I had finished nursing school that I started when I was 18, I would have become an IBCLC. And one day I realized you didn't have to be an RN to be an IBCLC, and that Georgia Northwestern Technical College was starting a new program. That night, I told my husband I was going to become an IBCLC and take over, help run his mom's business, and he said, "You're crazy." But here I am.
I love that because I did not know that at all. I mean, I know the name Jana Birdseye because of the and we're going to put a link to the website there. But I assumed there was a relation, but I didn't know that connection there. That
Really?
is so cool.
Yeah, I was never pressured to breastfeed by her. She had paid for me to have a breastfeeding class, and I was going, my breastfeeding class was scheduled like the next day, the day after I found out I had to be induced with Anna because I had low amniotic fluid. So they were like, she's got to come out. So I never got to take a breastfeeding class or anything. So, but it was just one of those things. I don't
It's
know.
one of those things. Yeah.
And then
did you
not long?
No, go for it.
Oh, I was going to say not long after I found out about the program for the lactation consultant program, I got laid off from my job that I had had for like 8 years. And I just told my husband, I was like, I'm going to college. I'm not going back to work. And that's what I did. He supported
and
me.
Here we are.
And here we are. He was my biggest support person, so I wouldn't be here without him or my mother-in-law. I mean, she was a huge mentor to me. She didn't ask me to become an IBCLC. She didn't encourage me or thwart me, but she is, when I decided to do it, she supported me wholeheartedly and has been a wonderful mentor to learn from. So I'm very blessed and very lucky.
That's so neat.
She is a celebrity.
Yeah. And she's got a wealth of knowledge. So, and I think that's what's really cool about the office and the business that you have too, is just that you've got several other IBCLC and lactation consultants there that can help and work with each other and impart their knowledge, on each other. And I know with I took a breastfeeding class at my job. So this was many moons ago before I was a chiropractor. And I remember taking the class and thinking, I was like, oh, I do not want to breastfeed. I'm like just going through all that and all the different, I was just like, this just is nuts. I was like, I'll pump and that'll be fine. I'll just do that. And then when he was born, I remember, I don't know, I guess it's all the hormones. It was like oxytocin switched or something in my brain. And I was like, oh no, I want to do this. And it was such a magical experience and connection with him. So I'm so thankful but that class I took beforehand was so instrumental in, I think, my successful journey, in that I felt like I had a good knowledge base before having him. So then I didn't feel like I was scrambling after the fact. So that is one of the things I usually tell my moms in the office. And I always recommend, especially as part of like a birth support team, is like connect with a lactation consultant beforehand and take some classes beforehand. Doesn't have to be real in depth, but for me, it was like learning different holds and things like that. It's not like I was trying to become certified, but just being aware of things, because it's something that it may not come naturally, like sometimes it can, but it can be, it's a learning experience.
It is a learning experience. It's almost like learning a new dance partner. Like you know your body and you know how it moves, but you don't know this other person's body and how it moves, and then y'all just kind of have to like learn each other when you get here. And just because it's natural doesn't mean that it's easy. And I wish everybody, if anyone reaches out to me while they're pregnant, I highly encourage them to take a prenatal consultation. So it's classes are great. Consultation is more one-on-one. So we bring the family in and we take like a full health history. We want to know how pregnancy's going. So we can look at breast development. We can look at any complications getting pregnant that could maybe affect milk supply. We do a breast exam, and then we go over all the prenatal education, like you mentioned, to talk about holds, positions, how to know when it's going right, how to know when there are levels of concern and who to reach out to and when to reach out when you have those concerns. And then even just scheduling a visit after baby gets here if there are no concerns, just to stay informed of the process, because breastfeeding is ever changing with the development of baby.
That's key, because sometimes in the hospital, if you did have a lactation consultant there come to the room, I feel like breastfeeding in the hospital right immediately after birth is completely different than when you're at home and breastfeeding. At least in my experience, it was just like, so yeah, you could have some eyes on you and help with that, but you've got colostrum. It's a little bit different in that hospital setting, if that, is where you're giving birth. And depending upon if you had a vaginal birth or cesarean, like all of that can play a part in it. But I think it's important for that after the fact at home. That's why I was so thankful for that, our pediatrician office that had a lactation consultant, because that's when it was like, oh, wait, we do actually have a tie. Like those little things that we did end up noticing later on. If I didn't have another set of eyes on it, I probably would have missed it or not known, some of the signs to look for. So I'm glad that you mentioned that aspect of like checking in after the fact, like once you get home and get settled, because it is different. It is a little dance between you and baby.
It's a lot different. And a lot of times it goes very, very well in the hospital because it's all reflexive. I mean, babies are born and they have two survival instincts, and that is to breathe and eat. And it's all, breathing is reflexive. So just like breathing is reflexive for babies and for us, feeding in the early days is very reflexive behavior. And sometimes when those reflexes start to integrate is when you see, and what I mean by integration is when they actually become less reflexes and more purposeful movements. So when those purposeful movements come into play, sometimes you kind of see breastfeeding kind of slowly decline. So that's why it's really important to have an IBCLC that you're comfortable with, or someone with breastfeeding knowledge that you're comfortable with, to just kind of make sure everything's going okay.
Exactly. Now I want to talk a little bit about some of the things that you work with infants, and now getting into like, I guess I want to touch on how it's that a successful breastfeeding journey is more than just a good latch, or the issues are more than just a latch type of thing, So sometimes I don't know if maybe some moms just kind of focus on that, like, oh, well, the latch is good. I always hear that in the office too, because I always ask, okay, how's nursing going? And they're like, oh, I think the latch is good. But I'm like, there's so much more to it, because sometimes I'll look and I'll be like, man, I see some little lip blisters, or if mom nurses in the office, I might hear some clicking and I'm like, well, so there could be other things. So I want to know, and this might be a very, very broad range of like, what are the things, why should someone, what issues should you go take your infant to a lactation consultant for? But that just, what are the things that you kind of help with in that area? And what are the things that you're looking for with a good nursing journey?
So I sometimes hear that the latch looks okay and looks like he has a good deep latch, but it's kind of painful. So nipple pain is a huge red flag. It should not hurt. Your nipples may be tender as they get adjusted, but that should go away after a couple of days. So nipple pain, you're looking at weight gain. If a baby is extremely fussy, even if they are eating and gaining well, if they are just extremely, extremely fussy, it could be gas issues where they're swallowing a lot of gas because of a shallow latch, or mom's fast letdown, or dairy sensitivity, any number of things. We're looking at pees and poos. We want to see adequate amount of pees every day. We want to see an adequate amount of poos every day, because if it's coming out, it's going in. Oh, let's see, what else do we look for? Just a healthy breastfeeding relationship. Like, we don't want mom overly stressed. I mean, there is going to be some stress in the early days, because one, you have a whole new human and you're kind of released from the hospital. Here you go, keep this little thing alive. So it's very tense for very tense for new moms, and then you're going on lack of sleep, because babies are nocturnal, so they are meant to be up all night and until they get adjusted to our kind of routines. We look for babies who might be a little bit more sleepy than others. We also look for jaundice, tongue tie, lip tie. There's certain things that we can't diagnose because we don't have that medical licensure, such as like an MD who can diagnose with tongue tie and lip tie and then diagnose jaundice. But we can look for the things, and then we can report back to the other healthcare team.
Totally recommend a referral.
Yes, we can. So if a baby's like really, really sleepy and maybe a little bit yellow, then we would refer them back to your pediatrician and say, hey, they may have some higher belly levels, so you might want to check that.
You had mentioned too this, I guess we both mentioned kind of this mother-baby dyad, because sometimes, yes, there are issues with infant nursing as far as like it is a problem with the infant, jaw alignment, whatever it might be, shallow latch, like those things. But then sometimes there is the issue of not that there's something wrong with mom, I don't want to say that, but that there could be an issue there as far as, and not that forceful letdown is an issue, but if baby's having a hard time keeping up with that and managing that, then it's kind of working together with mom and baby. So there's ways, and I know you can speak to moms about that as far as, okay, there's things that we can do to help baby with if there is that forceful letdown, And so it's not always, it takes two to tango. So make two to make the baby, but it also, there's that other little like rhythm and flow that you have with baby as well. So I like that your eyes are on baby, but it's also on mom too, to help in that aspect of things.
That is a unique position that we as IBCLCs are in, is that we have two patients. when we are working in a consultation, we have the mom as a patient and then we have the baby as a patient because, like you said, for the breastfeeding relationship to work out, you have to have both patients in a good place. And so sometimes you have a mom who has nipple pain, low milk supply, which could be hormonal or medical on the mother's side, or it could also be poor poor latch and poor transfer on the baby's side. So you kind of have to gauge what's going on there. You can have engorgement or too much milk, fast letdown. You can have all this going on one side because the baby latches really well to one side and not really well to the other side. So it can be a lot. We actually spend, in our first visit, we spend about 2 hours with the dyad. So
That's so good.
kinda,
I love it. And okay, so now I need to throw in here. It's like, I already know this, but so Jana and I have worked, I don't know how many infants we've worked with together. So that's one of my absolute favorite things is you send me infants, I send you infants. It's like, it's something about that birth support team. So not that you're not directly related to birth, but that postpartum, I mean, it's all part of it. So I always consider you like an essential member of the birth support team for the moms in my office. But we have been able to work with quite a few infants together. And I feel like all of those have been really successful. I feel like everyone that we've had, mom has been able to nurse. I'm trying to think. I'm pretty sure like it's, whether it got to the point, we're getting there and some of them it's
getting there.
Yes, trying to get there. But I want to speak to that. I love the relationship that we have because you and I will with obviously patient permission, we talk to each other. And so we can say, okay, this is what I'm noticing and this is what you're noticing. And like, this is what I'm telling mom. Okay, this is what I'm telling mom to do to help with that and what you're finding and what I'm finding. And I think that just increases exponentially how well that nursing journey can go. I've seen it. I think it's pretty cool.
100%. Yes. I love celebrating with you and their celebrations and then kind of bouncing ideas off of each other. And I honestly wish that every breastfeeding family realized how important a good body worker could be in their breastfeeding journey, just because of, like you mentioned, the different types of births, C-section births, and I mean you can go into more detail on the body side of things, but sometimes infants who are born via C-section have a little bit of neck tension or preference to look to one side, and so and then the tongue tie issue that can also restrict body muscles and affect feeding. So I wish everybody would seek out body work.
I know. I think it just goes so hand in hand and so well with your lens. And it's like having a lot of different lenses on that mother baby dyad can be so helpful. And I know I do have I kind of ask some of the same questions that you do as well, though, because I'm asking about, bowel movements as well, fussiness, clenched fists, like that extreme tension with feeding. I feel like that's one of the commonalities that we've seen in a lot of infants that we've worked with together is, they'll come with the nursing issue, but I'm noticing like, and you notice too, it's getting mom to notice a little bit of like, this is abnormal tension in the baby. This is really clenched fist. This baby is really ticked off, and what that tension is from. A lot of times it can be from the birth process. It doesn't have to be traumatic, but that's where I like to think that body work can come in, that pediatric care, that nervous system regulation to help ease that, which can then lead to, okay, now let's look at the latch and let's get the latch good and let's get the rest of that journey going well. And a lot of times too, and I know you've noticed this with the infants that we've worked with, is that tends to be a bowel dysfunction. Not in every case, but there tends to be a bowel dysfunction that goes hand in hand with a nursing dysfunction. Because you got to think, it's just both ends of the, the spectrum there,
That's funny because every time I follow up with a patient after they've been with you, I'm like, oh, well, did baby poop really good after y'all's visit? And most of the time they're like, yeah. And I'm like, because you get this lined up, it gets to working a little bit better. Yeah.
And then it's like once baby is more calm, I've noticed with some of them, it's like, okay, now nursing is, but we don't have as much tension in the body. And then it's easier to assess some of the, okay, what else is going on that could be causing some of those issues. And there's tons of episodes we have that talk about the how the the birthing process can impact feeding as well. And then I did an interview with a cranial sacral therapist and a pediatric chiropractor guru. And so those episodes go more in depth with it, and they we talk a lot about that there. But let's go over what are some of the things. Okay, so when we were chatting before, I always send my interview guests like an outline, so I don't like spring questions on them that they don't necessarily know about. And we were chatting about like the list of things that could be a breastfeeding issue. And so I have certain things that I always ask. I'm always asking, do they nurse well on both sides? So I know you're probably asking that same question as well, because a lot of times that can be, I'm looking at top bone of the neck, but also you're looking at it with a different lens as far as what could be going on there. That's one of the main ones that I'm asking. But in your list, you had that side preference, and then breast refusal. Do you see that a lot with infants that come in, or what is maybe one of the most common things that you see when working with patients?
The most common thing is nipple pain and low milk supply, and then babies who are compensating. So feeding might be going well, but baby's just super fussy, and mom just kind of knows that something is off. So we look for compensations or signs from the baby's body, that there are compensations going on. Like you mentioned, the lip blisters tell me that the baby's holding on with their lips, and that they're not able to latch on with their tongue as well as they should be.
What about like a clicking sound? What does that typically indicate? Because those are things I think that mom can notice, like, oh, I see blisters on the lip. Like you can kind of see them, and they're just like white little blisters. But another thing is like clicking sounds with nursing. What does that typically indicate?
You would be surprised at the parents who don't notice the lip blisters until you start to you point them out, and they're like, oh, really? Does it hurt? And no, they don't typically hurt. It's more like a callus. And then, yeah, clicking could be a sign of tongue dysfunction, and that could either be from immaturity, restrictions, muscle tensions, and it could also come from mom's fast letdown. So if baby's really just trying to work hard to keep up with that milk that's letting down, that could also be a sound of the clicking. But most of the time,
when
it's a
you
loss of
say,
suction.
okay,
Most of the time, it's
that
yeah.
The loss of suction.
Mm-hmm.
When you say, I think one thing I hear from a lot of moms is if they didn't have a successful journey was that they weren't making enough milk. How factual is a low milk supply? Like how often is it truly a low milk supply versus there is just some dysfunction in the breastfeeding dyad instead?
Honestly, a true low milk supply is very rare, actually. And most of the time, it is what we call a perceived low milk supply. And a lot of that comes from today's social media content. You have these TikTokers and Instagram famous people who have their full cooler or full refrigerator full of milk, and they're like, look what all I can do. And it kind of makes us moms feel inadequate. But a good milk supply is about 1 to 1.5 ounces per hour. So that's about 24 ounces in one day. And that's beginning at about a month old up to a year old. So it's not ounces and ounces and ounces every time that you pump. It really just depends. Each mom has a different output, and each baby has a different need. So As long as you're feeding and latching the baby and making that demand, then you should be able to produce enough milk. And then sometimes, like you mentioned, transfer issues. If baby's not transferring well, that can also cause a low milk supply.
Yeah, and that's why I wanted to touch on that as far as how often it really is a true low milk supply. Now, in your office, it's harder. When you give a baby a bottle, you can see how much they've eaten, right? But when you nurse, you're kind of like, I don't know. I don't know how much they ate. So how do you, what do you do with parents, and how do you determine the volume that the baby is eating?
So in the office during a visit, we do what we call a weighted feed. So we will take a weight with a very sensitive scale before baby goes to the breast, and then we will take a weight after baby goes to the breast, and we will measure how much is transferred, because that's only a little snapshot in the big picture. But then we tell parents to keep up with output. How many wet diapers, how many dirty diapers, watch your baby. If baby's always rooting, always looking hungry, always chewing their hands, and those are signs that baby may not be feeding well. And then you can also see that your baby gets full throughout a feeding. So babies have a gas gauge, and it's completely different than the gas gauge in your car. So this is empty, hands are up, and as baby starts to fill up, the hands go down and the hands open. So there are signs that you can pay attention throughout the day and throughout each feeding session on whether your baby's getting enough or not. But
I think that's important.
It's very nerve-wracking because, there's no little ounce markers on our breasts to tell us how much baby's taking in each feed.
I know. It would be nice. Just a little marker to be like, oh, okay.
Okay, you're good. You're good. But,
yeah.
And then again, each feed, time is not a good measure. So each feed can last different amounts of time, and sometimes baby's thirsty, sometimes baby needs comforting, sometimes it's just a snack, sometimes it's a little lunch, and sometimes it's a big old dinner. So just like our needs change throughout the 24 hours daily, so does baby's.
That's a good point to make. Let's see. I want to touch on a little bit with birth presentation. So, because I will notice things too if there's been breech, and then it's also too if we ended up with a cesarean for breech, and then even sunny side up, and slower fast descent. Those were some of the things that you mentioned. So let's chat a little bit about how the birth process can show up as a latch dysfunction in your office, or what you notice with those birth processes.
So we always talk a lot about pregnancy. So I want to know how well your pregnancy has went, if baby was stuck in one position throughout the pregnancy, because if you see a tight baby, that could be a sign. And then as a baby is born, they actually, if this is like the pelvic bone, baby actually passes under the pelvic bone and kind of opens up their neck, and so kind of flexes out, and that's the first sign of a good latch is baby's able to look up and open their mouth really, really wide. And so sometimes with the fast descent, or if there is a slow descent and they get stuck, or if they're breech or sunny side up or born via C-section, they don't get that nice opening as they pass through the birth canal and under the pelvic bone to have that nice release that leads to better breastfeeding behavior. Do you?
And it doesn't mean that if you did have that birth process that your breastfeeding journey is doomed. But it's just be aware that, like, okay, maybe you do need some additional support in helping that breastfeeding journey by seeking, pediatric chiropractic care, that IBCLC, like having those other eyes on there to help with establishing a good latch and releasing some of that tension, making sure nervous system is working well. Like, I think, that can go a long ways too.
And just just because it can happen doesn't mean that it is going to happen. But like you said, yes, having those members on your team is good so that you can follow up with them and just prevent any problems or look for problems that might arise. But sometimes it happens and sometimes it doesn't.
With nipple pain, you said that was one of the common issues that moms present to you with. What are some of the common causes of that? Is it typically a baby issue or a mom issue? I mean, I know there's going to be lots of different degrees in there of what's causing the nipple pain, but how do you help moms and babies who are suffering with that?
So the first thing we do is work on positioning. One of the number one things that I notice is that moms often support baby on the back of the head when they're trying to latch the baby. And a lot of times if you're pushing on the back of the baby's head, it actually pushes their chin into their chest, which makes it harder for that mouth to open wide. So we work on positioning of the mom to allow baby to get that nice flex position. That doesn't always fix things, but if we support the neck and not the head, that also gives the baby a better chance at latching. And a lot of times in our office, we practice what we call baby-led attachment. And that's kind of just letting mom lay back baby skin to skin and let baby root for the breast. And you'd be surprised at how many babies will latch on to the breast without any assistance from mom. And a lot of times by letting baby use their natural reflexes, that will fix a lot of the latching issues and a lot of the nipple pain. But nipple pain can come from...
I know you talk about that because I had parents that I've worked with that saw you, and I would be like, okay, so what did Jana say? And she's like, well, we did this thing where I laid back and baby just naturally tried to get him. I was like, okay.
It can be very nerve-wracking for moms. I'm like, and especially sometimes on our first visit, I'm like, I know we just met and everything, but you got to trust me on this. Let's just lay back, put your baby on your chest, relax, enjoy them. Mom and I will talk and get some questions answered and things like that. But a baby can get to the breast on their own and they can latch on their own. And it is a beautiful thing when it happens. It doesn't happen every time, but it does happen a lot of the times. But usually if it doesn't happen, there is something functional going on with the baby that can make it harder for them.
And that's what's cool is you use all these little things to say, okay, there is something else going on. I mean, I'm always looking at the same thing too. I'm like, gosh, there is, something else going on. What's going on here? Who else can we pull in to help with this mother-baby dyad? I want to mention one thing as far as we talk a lot about, although this is all about IBCLC and infant nursing, it's that we've already talked about, it's the dance with mom and baby, and there's a rhythm there in that. I think sometimes moms come in and bring baby in for chiropractic care, and then they want to bring, quotes again, the problem in, like we want to work with what the issue is. So I'll be seeing infant, but I do see really good results when I can get mom and infant under care, because if mom is stressed as well, and I'm merely looking at it as like, how is the nervous system functioning? So can we help calm mom down? Like that's all I'm really looking at with this. Like, can we bring some ease and some calmness to mom? Now, yes, if baby is more calm, that tends to make mom not feel as stressful, but there is something to be said for both mom and baby to be under care because they are so just intimately connected. And it can make a huge difference. So, and I know that you know that too, because I think you've even mentioned that before. And I think I've said it sometimes too. I've been like, oh, I wish this mom would get under care because there's just a lot of stress there on both sides.
On both sides. And a lot of times, even if the baby's not making those compensations, sometimes a mom will be making those compensations for the babies, such as leaning up to feed. And then, you've got all this neck and shoulder pain.
Oh, yeah.
If they tell me baby's going to the chiropractor, I'm like, oh, okay, did you get your adjustment too? So I'm a big advocate for self-care.
I love it. Yes, yes. I mean, it's very, very helpful for both mom and baby. Let's see. Any other things you want to add as far as that? What denotes a successful journey? Maybe talk about the biomechanics of nursing, because it's not just latching. Like, it's baby has to latch. We have to have good jaw alignment. We have to have good nerve supply there. But then they have to be able to suck, like maintain that suction and swallow and breathe. So it's kind of like all the things that we're looking at, right? It sounds really complicated when you put it like that, right?
When you put it like
So
that, yes.
yeah, can you go through or highlight some of that, or where there could be dysfunctions in many different points of that process?
So many different points. So we do an oral assessment on every single baby, and one of the most important things we look for is tongue function. So if this, let's see, if my arm is the lower gum line and my hand is the baby's tongue, you actually want the baby's tongue to extend out over the lower gum line. Then it has to grasp onto the breast tissue, hold the breast tissue, massage the breast tissue, and then it has to go up and then down and create a big, big vacuum for the milk to come out. And it has to do that over and over again. And then the other, it's, oh, my table's moving, sorry. And then if the tongue has good function, then everything else kind of falls into place. Like if you have too much jaw movement during a feeding session, then that's a compensation. That can lead to nipple pain. That means baby's having to use these extra muscles to hold on because they can't hold on to the tongue, hold on with the tongue properly. And then the holding on with the lips. So there are a lot of compensations, but that's the basics of it. You want a really good tongue function, and you need all of those that, and there are so many muscles that help to control the tongue. So it just all your whole body. Breastfeeding is a whole body thing. It's not just a mouth thing. It's a whole body function. And for me to know what is a good breastfeeding relationship is the mom happy with her journey? The awesome thing about breastfeeding is that it is your personal story to tell. And so you can guide wherever it goes. And sometimes there are hiccups along the way, and we may have to make a little side turn, but ultimately it's your journey, and you can decide what works best for you and your family.
I know. And that's a beautiful thing, though. Like there's people out there to help. I'm glad that you mentioned and you said that it's a whole body function, because I don't know if you've seen the picture too on the internet. It's like it looks like a cadaver thing, or just like parts of a body, where it shows the tongue and how it's actually connected all the way down to like the feet, like it's you get that connection. Like it literally is a whole body function. It's a whole body function.
And all the reflexes, like the hands, baby needs to be touching, the feet touch, the chest, the chin, like it is a full body connection. And the more baby is connected to the mom, the better the breastfeeding relationship is going to be, and the latch.
Exactly. Let's see. Anything else that you wanted to mention as far as things that you work with, things that you see, how you help mom and baby? Maybe something that we haven't talked about today that we should?
Well, of course, I specialize in babies with Down syndrome, of course. So I have seen quite a few babies with Down syndrome. They're referred to me by the Down Syndrome Association of Atlanta. So that's something that I'm very, very passionate about, because I know what it feels like to experience that, the bias that you can get when you have a child with special needs. And like I mentioned, my breastfeeding issues were not related to Down syndrome at all. I was in severe nipple pain. And for quite a few weeks, I thought that was normal. Like, oh, this is normal. It's going to go away. And it never went away. So that's just to have someone really dive in and find out what is going on versus just kind of saying, oh, your baby has Down syndrome or your baby has different abilities or a special need. That's kind of why you are having issues. That's to be expected.
Yeah, to like write it off and be like, oh, well, that's the issue. Yeah. Because that's not the case.
It's not the case. Not always.
Yeah.
I mean, there are some instances where the low muscle tone or things like that can be causing issues, but it's not always the case. I've seen quite a few.
I have a
successful relationship.
I have a mom. Yeah. I'm glad you mentioned that and you mentioned your story because I have a mom who recently too ended up with a Down syndrome baby, like did not know during her pregnancy as well either. And so she gets adjusted, baby gets adjusted. He's one of my favorite patients. He's the sweetest thing I've ever seen. And they have a really good nursing journey now, like, a couple little hiccups there. But, and I know in their instance too, it's that low motor tone that can be probably one of the biggest issues with that, but he's doing just fine. So I think it's important to know, that, and I'm glad you have that specialization in helping parents who do end up with a child that has a little bit of special needs, because you're going to need that little bit of that other lens and that extra help,
You are, definitely. And the mom who helped me actually also had a daughter that had special needs. So it's kind of, you just have, if you know kind of thing.
I like that you have that in your wheelhouse of things that you can offer families and parents.
Send me all the special babies. I love it when my worlds collide. Love it, 100%.
Yes. It's so fun. Okay, so tell us about Lactation Consultants of Atlanta, like where people can reach you, who all is there, and like, how people can get in touch with you guys.
Well, we have our website, which is breastfeedingatlanta.com. We are a legacy business. I think I've already mentioned that my mother-in-law is the founder. We are Atlanta's longest private practicing lactation clinic. We've been in business for over 30 years. So you could almost say that she started private practice in the Atlanta area. So she is there. Myself, we have Melissa as one of our other lead consultants, and then we have some other contractors who work with us as well. So I think there's about 5 or 6 of us on board right now. We have a website. We have a Facebook at Lactation Consultants of Atlanta, Instagram, and then our phone number. We have somebody available until 9 p.m. at night to answer the phones, because breastfeeding is not just a 9 to 5 thing. And
nope.
So we try to do our best to be available when moms have those panicky moments, and you can book 24/7 on our website, because you'd be surprised when you're up at 2 o'clock in the morning, you're like, oh, I need help as soon as possible. And we do try to keep.
I get a lot of patient bookings because I do online booking too, and I get a lot, and I'm like, oh, they booked at 2 a.m. They must have been nursing.
Yeah, they must have been nursing. They must have been having a rough night. Yeah, it's very common. So that's been pivotal in the
and
business.
You guys also do
just
that online booking. No, that's huge, and that's easy.
Yeah, we also run a free support group once a month, and then we
that's
do
what I was about to add.
lactation. Yeah. So the support group is free for anybody.
Okay.
It doesn't have to be one of our patients, and it's hybrid, so you can attend online or you can come in person to the office. Then we also offer support groups with some pediatricians' offices. We rent hospital-grade breast pumps. So if anybody needs to rent a breast pump because they're having some supply issues, or if baby may be possibly in the NICU, we do the Amita hospital-grade breast pump. And then we also help businesses establish corporate lactation programs so that they can meet all the state and federal regulations for a mom who returns to work while breastfeeding.
That's so good, because that's when I took my class. It was through one of the corporate educations. So, yeah.
Really? Okay.
When I took the class and I was like, I don't want to do this. And then I was like, wait, I do.
But it's free. Your company pays for it. Yeah. So we set up breast pumps for a lot of our corporations and do the classes and return to work consultations. That's something I'm really passionate about because, like you, I used to be corporate America. And going back to work and breastfeeding and leaving baby at home, and it's so hard.
That's tough. I know. I nursed both of mine for 2 years. Well, one was like 20 months, one was 24 months. And I pumped for felt like forever. You know, it felt like forever. But yeah, I'd carry my little pump around. I'd come home from work and be like, this is how productive I was, you know, like, but I'm glad I had the ability to do that though. So
right.
That's
it's
the big
hard
thing.
not to measure your success in ounces when you're working and pumping mom. Well, I had a good day today, honey.
I know. I had a good day. Yeah. And then noticing the changes with your body and everything. I mean, yeah, the whole nursing journey is just, it is very interesting how your body changes,
Beautiful.
how baby's body changes, and how the milk changes. It's just so cool. I know. It's so cool. It's so divinely designed and created. And I just think it's really neat. So
I 100% agree.
thank you so much. Yeah, I figured you would. Thank you so much for being here and taking the time out of your schedule to chat with me today. I learned a lot. So this is great. I love working with infants with you. I hope everybody has learned something from this. Please reach out to Jana if you've got questions or anything. She's a wealth of knowledge. And again, thank you so much for being here. And then stay tuned, friends. We'll have another episode for you next week.
Thank you.
Thank you for joining us on the Aligned Birth Podcast. We hope you found our discussions informative, inspiring, and enjoyable. Remember, when your body, mind, and intuition are aligned, you have the power to overcome any challenge that comes your way. We appreciate your support and leaving a review or rating, signing up for our newsletter, or becoming a direct listener supporter. Your contribution helps us continue delivering valuable content and reaching more listeners like yourself. Stay connected with us through our newsletter to receive the latest episodes and bonuses straight to your inbox each week. You can also connect with us on Instagram at aligned_birth. All links can be found in the show notes. Together, we can make a difference in the lives of the birthing individuals and new moms. Thank you for being a part of our community. We look forward to sharing more empowering conversations on the Aligned Birth Podcast. Until next time.